Some of them are really simply named. Some of them are a little bit confusing. To get to what I want to see, though, I'm just going to go ahead and get rid of everything except for the muscles and the skeletal system. I'm using the high resolution head and neck. You may notice when you first pull this guy up that he's missing some muscles. Just go here, hit the muscle tab, and then hit it again, and all the muscles are going to pop up. So first thing we're going to see on our list today is going to be the occipitofrontalis muscle, and it's going to be located exactly like what it sounds like. If I touch here, it's going to highlight the entire thing. There's technically a frontal belly. The frontal belly of the occipitofrontalis would just be here in the front. The occipital belly, we're going to go all the way to the back. And when we go to the back of the head, you can kind of see these little lines right through there. That's the occipital belly, and of course it's bilateral. Those guys connect into the supreme nuchal line, and if you remember in osteology, you can't really see them very well, right? So again, you may have had to hallucinate to see it, but it's because you never see people in the gym like doing this. Getting that occipital belly, really pumping up that back of their head. Some guys are like that though. You ever seen those guys who've been using growth hormone and stuff like that too long, and like the temporalis muscles like way out here and stuff like that? It's really freaky looking. Anyway, this thing right through here in between our two eyes, this is known as the procerus muscle. We'll give it just a little color. Okay, procerus muscle. The procerus muscle is going to be between the two eyes, and then we're going to see circling the eye is going to be the orbicularis oculi. The orbicularis oculi muscle technically has two parts. It technically has this outer portion that actually covers around the orbit of the eye, and then it has this inner portion that covers over your eyelid. So one's known as the palpebral portion, one's known as the orbital portion. But if you look on your list, you don't see a difference between the two, so you don't have to tell me a difference between the two. I'm just letting you know. Okay. If we remove on the other side the orbicularis oculi muscle, we go here, and now what we can see is that there's a strip of muscle underneath the eye that looks a little bit like an eyebrow. And let's do that. Let's give him just a little bit of color for his eyebrow. See that guy right there? It's like an angry eyebrow. That is the corrugator supercilii. And the way I remember it is you can be super silly with your eyebrows. You know, you can move them around and do all kinds of weird stuff. So supercilii. I'm super silly. Anyway, if that helps you remember, that's great. If it doesn't, that's too bad for you. On your nose, unsurprisingly, we're going to find this guy. That's our nasalis muscle. Nasalis muscle goes on both sides. So far, everything we've seen is bilateral except for the procerus. So if you see one corrugator supercilii, you know there's another one on the other side. Procerus, though, is one midline that crosses those. Now, I'm going to point out this muscle first here, and it's known as the levator labii superioris, and it tells you exactly what it does. It elevates your lips. So levator labii superioris. If there is a levator, there's probably also going to be a depressor. Does that make sense? And if we look inferior to the mouth, that's what we're going to see. This is our depressor labii inferioris. Now, we're going to go back just for a second, and we're going to look at our levator again. And we're going to notice that there's another muscle that does the exact same thing right beside it. But unfortunately, it has a super duper long name, and we're going to look at it. It's the levator labii superioris aliquae. You can say it however you like, nasi. Why is it called that? It's called that because it has a connection into, let's do a different color because that's just red right beside red. It's called that because one part actually goes over to your nose. So some of these fibers, and you'll see it maybe better on the models, actually goes into the alar cartilage of the nose. Now the alar cartilage of the nose is this cartilage here that's a little wing-like, and it'll look like a wing when we take a look at it. It's known as the alar cartilage. So it connects into the ala, but it also goes to the lips. And so for testing purposes, we got to make sure the long strappy muscle has a long name. We okay with that? So levator labii superioris aliquae nasi is right beside levator labii superioris. We okay there? Now, if we look on this other side attached to our zygomatic bone, we can see that there's two muscles. And that's nice because they both have the word zygomaticus in them. We have a zygomaticus minor. And if you have a zygomaticus minor, what are you going to have just underneath it? A major. Okay. Do you notice how this zygomaticus major here has some openings or holes in it? See that right through there? Let's look at it on the other side. See this nice big opening right through there? When you see that, that lets me know that that person had dimples. So when you see someone smile and you can see those dimples pop up, it's because they have a hole essentially in that zygomaticus major muscle, and it shows up. All of these muscles that we see right through here are reflected in our face, and they are very superficially located in the fascia. One of the muscles that is really superficial is this guy right through here, known as the risorius muscle. This risorius muscle you're not going to see on all the cadavers because it is so superficially located in the fascia. The majority of the time it's cut away. Okay, so again, when you cut the face off, frequently this will go with it. On this high resolution model with Victor, and I want to say Hans, you can see it on both of those, but even if you pull up the full cadaver for Victor, which is what this would be, you don't see this muscle, okay? So again, I've only got a few cadavers. I can use that for testing purposes. Now, if we kind of zoom in a little bit, we can see that there's this muscle that's making this nice angle right through there, that nice angle. So again, this is going to be our levator anguli oris muscle. Levator anguli oris muscle. If we have a levator, again, we're going to have one that does the opposite motion. The one just below that is going to be the depressor anguli oris muscle. Let's give that just a little bit of color.
Sorry, which one was the...
So the levator is hard to see. You have to kind of look really closely in between the zygomaticus minor and in between the zygomaticus major muscle. It's deep to both of those, anchored to the maxillary bone, going down to the actual mouth. So it's a little bit smaller compared to this guy, which I guess maybe means we frown too much. I think that's it? We frown too much? Maybe we should spend more time smiling. Been told smiling burns more calories too, so maybe that's like, incentive for some of us. You remember how this guy was the orbicularis oculi? This is our orbicularis oris. Orbicularis oris muscle. Again, they both make circular muscles or circular shapes, and so it's pretty easy to identify them. If you remember in osteology, we said this area of the chin was known as the mental protuberance. The muscle that's attached there is known as the mentalis muscle. So our mentalis muscle is just right there, the mental protuberance. Now there's one more muscle, and if you've ever seen Charlie Chaplin, you guys ever seen Charlie Chaplin, the old guy in the black and white movies? See the little mustache right through there, our Charlie Chaplin mustache? That muscle is our depressor septi nasi muscle. And it's going to do exactly what it sounds like. It's going to depress the nasal septum. It's kind of hard to see on some of the models. Okay, so you may or may not be tested from that point of view. You can technically see it, you just may not be able to see it very well. Okay. Now, all of these muscles that we just looked at, these are all muscles of facial expression. Okay. All of our muscles of facial expression are going to be innervated by the same nerve, which is our facial nerve. So what I'm going to do is I'm going to put in all the nerves. And when I put in all the nerves, we can see there's lots of nerves through there. But we're going to be able to identify the facial nerve easily because we're going to add in this guy right through here, which is going to be our parotid gland. The parotid gland is going to be a big gland that sits on top of the ramus of the mandible. I'm going to use our little color box right through here, and we're going to ghost the gland out so that we can see through it. Now, when we do that, we can now see that embedded within the parotid gland are these nerves. Those nerves right through there all come from the facial nerve. I'm going to go ahead and I'm going to remove the risorius, and I'm going to remove this other muscle known as our platysma. And now we can see all those different nerves, okay? The very first one that comes out is going to be the temporal branch of the facial nerve. And yes, you have to say branch of the facial nerve. You can't just say temporal nerve. It's got to be temporal branch of the facial nerve. The next one is going to go towards your zygomatic bone. And let's go ahead and let's remove this muscle just so we can see this a little better. This table just can't keep up with me. Just below it, do you see how that next nerve is going over here to your zygomatic bone? This is the zygomatic branch of our facial nerve. Now, of course, as it's going there, it's going to fan out a lot because it's got a lot of muscles that it's got to innervate. But if you can follow it towards the zygomatic bone, you know it's the zygomatic branch. The next one is going to go to this muscle we see here, which is known as our buccinator. See that deep muscle right through there? This is the muscle of the cheek, known as the buccinator, or you may see it called the buccinator. You can call it any way you want to, or call it whatever you want to. So that's going to be our buccal branch of the facial nerve. Looking on the angle of the mandible here, I can see that there's another nerve just passing through there. This is going to be the mandibular branch of our facial nerve. We've got another branch that's going to the cervical area. So this will be the cervical branch of the facial nerve. So despite the fact that there's a lot of nerves in the face, we know the facial nerve because if we can find the parotid gland it's coming through there, we'll always be able to trace it back to that. Now, the other thing we typically do is we have a little mnemonic that we'll say, because we're going to see the parotid gland. Let's say we see it right through here. There's a parotid gland. You're then going to see the nerve come up and out to the temporal area, to the zygomatic area, to the buccinator or the buccal area, the mandibular part, and then of course down into the cervical area. So we just say to Zanzibar by motor car. You can do that to your face. Put your hand right there. Temporal, zygomatic, buccal, mandibular, and then the cervical part's literally going to hang off and go to the platysma. Okay. Now, there's another version of that called Two Zebras Bit My Cat's Paw, because there's actually one other branch that goes behind the ear known as the posterior auricular. So technically that'd be the more complete version if you were going to use that to help you remember all the branches of the facial nerve from the parotid gland, but Two Zanzibar and bimotor car is good enough for our list. Are we okay with the facial nerve and its branches? Now, those are the muscles of facial expression. The buccinator muscle is sort of in between, whether it's a muscle of facial expression. We do typically say it is because you puff out your cheeks and that's a facial expression. I'm going to go through now and I'm going to show you the muscles of mastication. Mastication is how we chew our food, right? Mastication is how we chew our food. So the first big muscle that we can see here is going to be this guy, and that's our masseter. The masseter is going to sit on the ramus of the mandible, just like our parotid gland did a second ago. We're then going to see that there's a big muscle up here in the temporal fossa that goes underneath this arch and connects into the coronoid process of the mandible, known as the temporalis muscle. I'm going to go ahead and point out these other muscles that are on top of the temporalis muscle, but these are not muscles of mastication unless you eat from your ears, okay? Most of us don't. This guy that looks like a big fin, that's your auricularis. This muscle here, this is also your auricularis. This muscle here, it is also your auricularis. Now, on our list, it doesn't differentiate between anterior, posterior, and superior auricularis, and you don't have to differentiate either, okay? Normally, if I do tag this, I typically just put a pin right here in the big one, just because it's the easiest to see, and all you have to write is auricularis. You don't need to write superior. We okay with that? Now, that's masseter, that's the temporalis, and now what we got to do is we're going to go to the other side of the face, and we're going to remove these superficial structures so that we can see our mandibular notch. Now, if you remember in osteology, there's a spot on the mandible that looks like somebody kind of pushed their finger into the bone, and we call that a notch when we see something like that. So right here through the mandibular notch, we're going to see that there's a couple of muscles. One of these muscles themselves are actually going to go to your temporomandibular joint, okay? And we can't see it really well, but we can see there's a muscle right by the TMJ, which is right there. And that's our lateral pterygoid muscle. The lateral pterygoid muscle. We're then going to see that there's another muscle that goes down towards the angle of the mandible. And if you remember in osteology, this is the location of where we saw the pterygoid tuberosities. This is the medial pterygoid muscle. The way I remember it is just that the medial pterygoid goes to the angle of the mandible. The lateral goes over here to your temporomandibular joint. Now, I'm going to go ahead and remove this guy here, this muscle you see there, that's actually part of the temporalis. Remember, that goes to the coronoid process of the mandible. I'm going to remove that. And then what I'm going to do is I'm also going to ghost out the mandible so that we can see through it, just so we can appreciate that a little more. Okay, so now we can see those muscles just a little bit better. They look nice and big right through here and there. And of course, those are going from their pterygoid plates, right? We saw those in osteology as well. Now, the muscles of facial expression, those are all innervated by your facial nerve. The muscles of mastication are all innervated by your trigeminal nerve. So muscles of mastication, trigeminal nerve. Now, we should know probably our Roman numerals. If you remember, cranial nerve 5 could also be written as a V, right? And the trigeminal nerve has 3 branches. It has a V1, has a V2, and then it has a V3. V1 is sensory and sensory only. V2 is sensory and sensory only. V3 is both. Okay? So specifically, the muscles of mastication are innervated by the V3 or the mandibular division of our trigeminal nerve, which we'll see in a minute. Now, if we look at the face again, and we go ahead and we remove all the muscles, I'm going to go ahead and get rid of all the muscles. I'm going to then take the skeleton and I'm going to change the color to black, and then we're going to add in all of our nerves. Okay. When we do that, we're going to be able to see the nerves nice and easy, and that's the only reason why I'm doing this, because we can see the nerves nice and easy. Okay. Now, in osteology, we had to learn a lot of openings from the skull, and that's going to come back and pay us right now. If you remember in osteology, when we looked right here above the orbit of the eye, we saw either the supraorbital notch or the supraorbital foramen. Passing through that is the supraorbital nerve. So if you look right through here, this is the supraorbital nerve. And what artery do you think would be traveling with it? The supraorbital artery and the supraorbital vein. We'll do that, I guess, in yellow. Now, beside it, inside the orbit of the eye, we're going to see that there's this little ligamentous ring known as the trochlea, which is an anchor point to one of the extraocular eye muscles. And so this nerve that passes above it is known as the supratrochlear nerve. If we saw an artery there, what do you think we would call the artery? Supratrochlear artery. If we look underneath where we saw the supraorbital foramen, we see that there's also an infraorbital foramen right there. See that? I'll do it on the other side because the facial nerve is on the other side. The one that's coming out of the supraorbital foramen right through there is going to be our our infraorbital nerve. I think I just got it and then I got rid of it. Infraorbital nerve. So again, that passes out of the infraorbital foramen. Now on the zygomatic bone, if you remember, this hole right through there was known as the zygomaticofacial foramen. The nerve that goes out of it, zygomaticofacial nerve. On the posterior part of where we see the frontal process of the zygomatic bone, we're going to see on the very back of it, the posterior part right through there, there's a nerve right there, okay? That was known as the zygomaticotemporal foramen, right? Passing through the zygomaticotemporal foramen, not surprisingly, is going to be the zygomaticotemporal nerve. We're going to go back and we're going to look at the mandible. We're just going to unghost it. Put it back. What was the name of that opening right there? Remember, this is the mental protuberance, mental foramen. So what do you think the name of that nerve would be? Mental nerve. It's that easy. Now again, where did these nerves come from? They're all sensory to your face, so where do they come from? The trigeminal nerve. So a patient presents to your office with an inability to feel over their left cheek. Which of the following nerves is most likely involved? Generically, we could definitely say trigeminal. But more specifically, this is right around the maxillary bone, so we would say the maxillary division of the trigeminal nerve, or V2. Does that make sense? Patient presents to your office with a visible drooping of the muscles on the right side of their face. Which of the following nerves is most likely involved? Facial nerve, right? If it's a muscle of facial expression or an inability to perform that by your patient, then we think facial nerve, okay? If the patient's having weird sensations, then we're thinking trigeminal nerve. If they can't chew, now we're also thinking trigeminal nerve, specifically V3. We okay with that? Now, these nerves, they all come from inside the skull. And so what we're going to do now is I'm going to go through and I'm going to remove the sphenoid bone, and I'm going to go through and I'm going to remove the temporal bone. Catch up, table. The first thing we're going to see is a very dense, thick structure known as the dura mater. It's not on our list. We're not worried about it. The next thing we're going to see is the temporal lobe. Again, it's not on our list. We're not worried about it. And once we remove the temporal lobe, we see something that looks like somebody hid their chewing gum inside of our head. You see that right through there? That is the trigeminal ganglion. Now, the trigeminal nerve comes from the basilar pons at something known as the pontine medullary junction. We don't care about that. We don't need to know that here. I'm just letting you know that's where it comes from. So the trigeminal nerve is this little sliver of the nerve that connects into the trigeminal ganglion. What happens inside of a ganglion? Synapses, right? One nerve talks to another nerve. So the trigeminal nerve is going to talk in the trigeminal ganglion, and then it's going to send impulses out either through the ophthalmic division, which we can trace into the orbit of the eye, or the maxillary division, which again we could trace into the maxillary bone of the face, or we can see it going down towards the mandible as the mandibular division of the trigeminal nerve, which again we could also just write as V3, right? V3. So trigeminal nerve will be the first part that connects into the trigeminal ganglion. And then you have ophthalmic, maxillary, and mandibular division of the trigeminal nerve. Now what we're going to notice is that the trigeminal nerve, where it gives us the mandibular division, gives a lot of branches, but there's two big thick ones, right? See right through there, there's these two big thick ones right through there. Okay. One of these guys is going to go inside your mandible. Okay, it's the inferior alveolar nerve. So the inferior alveolar nerve is going to go to the alveolar fossa, and it's actually going to supply your teeth. Superior alveolar go to the maxillary teeth. The inferior alveolar nerve go to the mandibular teeth. The inferior alveolar nerve is then going to give us our mental nerve. So the mental nerve is the terminal branch of the inferior alveolar nerve that passes through the jaw. Moving anterior to this guy right there at the mandibular notch is going to be your lingual nerve. Now, there's a couple of ways we're going to know that that's your lingual nerve. Okay. Goes to the tongue. That's one of the easiest ways. It just goes to the tongue. If the tongue's not present, though, there's something else. I'm going to get rid of the mandible, but maybe not really. Maybe we could just ghost it out, because I do like you being able to see the alveolar nerve go through there. So let's just ghost it out. See how we can see that going through there, and then you can even see it going to the teeth. You can follow it through here, it goes into the teeth. This guy right through here, the lingual nerve, is going to connect into a little ball of tissue. Now I know I have a lot of stuff on the table, but it doesn't matter because I can see that attached to the lingual nerve is a little ball of tissue. That little ball of tissue right there is your submandibular ganglion. If you can see the submandibular ganglion, you can find the lingual nerve and vice versa. So let's put it back in anatomical position. See how it's got that connection in there? And it connects right into the lingual nerve. Now, we said that the lingual nerve comes from where? We said that was the what nerve? It comes from your trigeminal nerve. Okay. The submandibular ganglion, though, is innervated by the facial nerve. So this guy right through here, and it may be hard to see right off the bat, but if you look right there, there's a nerve that feeds into the lingual nerve. That's known as your chordae tympani nerve. You don't need to know it. It's not on our list. But that's a branch from the facial nerve that hitches a ride with the axons of the trigeminal nerve. It then gets off the bus, you could say, into the submandibular ganglion and then supplies the submandibular gland. It then goes back on the bus and goes the rest of the way to the tongue and then supplies the sublingual gland, which we'll see later when we go into the oral cavity. We okay with those nerves? We okay? We gonna make it? You surviving? Again, normally I wouldn't go straight through all this material like this, but there's only one thing left, and it's the blood vessels and then our palatine nerves. That's it. I'm going to go ahead and show you the blood vessels because they're very straightforward, and then I'll show you those last two nerves, and then that's all I got to show you today. Okay? So let's go ahead and let's get rid of all the nerves. I feel better already. Let's go to the cardiovascular system. Let's go to the maxillary external here. Let's go into the internal carotid. Let's add that. Oh, no, common carotid. Now, we already saw with our last material that our common carotid gives us an external and an internal branch. We saw that from the internal branch, it doesn't really do anything but go inside the carotid canal and then goes inside the skull. The one we want to look at today is this guy, which gave us first our superior thyroid artery. So we got our superior thyroid artery first. The next branch that we're going to see coming off of here is going to go to your tongue. If it goes to your tongue, what's a good name for it? The lingual artery. The next branch coming off is actually going to go across your entire face. So what's a good name for that? The facial artery. Thanks for playing. I appreciate it. Now let's follow the facial artery's path because it's going to be super easy to identify its branches. If you look, let's put it in an anatomical position. If our lips were here, we'd see that we have the inferior labia and the superior labia. So this is going to be the inferior labial artery. The one above is going to be our superior labial artery. Nice and easy. I like easy. If we look right beside your nose, going to the lateral cartilage of the nose, we're going to find our lateral nasal artery. Lateral nasal artery. And then where this artery ends around the medial angle of the eye, also known as the medial canthus of the eye, is going to be the angular artery. Now we go back to the external carotid, and we can see that it's got a couple more branches that are coming off. One of these is a really big, thick branch right through here. That's really long and going inside the actual nasal cavity. I don't know if you can see that, but it actually goes inside the nasal cavity. That's going to be our maxillary artery. Our maxillary artery is going to be found underneath the mandible. You can frequently see it inside the mandibular notch, though. So again, even though it's deep to the mandible, you normally can see it at the mandibular notch. The very first branch that comes off and goes inside your skull, you should be familiar with as the sulcus for the middle meningeal artery from osteology. So the middle meningeal artery comes from the maxillary artery, but a lot of arteries of the face come from there. That's just the only one that I'm showing you. As the maxillary artery continues deep to the face, there's another artery that goes across your face, but it's super superficial, like it's on top of your zygomatic bone. It's not deep to it. That's our transverse facial artery. And then we get to the final part of our external carotid artery, which is right here. And this is known as the superficial temporal artery. We're going to look at our last two nerves that we needed to see for today, and I think that's everything for today's material. Okay. What I'm going to do is I'm going to get rid of all the blood vessels. I'm going to go to the skeleton, and I'm actually going to get rid of pretty much everything except for the facial bones and the neurocranium. Okay, we don't need really any of these guys. And we don't really need the mandible either, but we can leave it on there, it doesn't matter. We're then going to put the head in anatomical position, and then we're going to tilt it upside down to look underneath the palate. Now, we should remember that the palate is made out of the maxillary bone and then the palatine bone. Okay, so the maxillary bone and the palatine bone are going to make up our hard palate. You may even remember that there was a greater and lesser palatine foramen. What we're going to do now is we're just going to go here and we're going to look up palatine. And then we're just going to scroll down. And eventually we're going to come to something that in parentheses says V2. When you see V2, what does that mean? V2 is referring to what? The maxillary division of the trigeminal nerve. That's right. So I'm going to go ahead and I'm going to add these guys in, and we're just going to take note that these come from the trigeminal nerve. So again, sensory to all your face, including the nasal cavity and the oral cavity, that's all coming from the trigeminal. okay? When we look at the palate, we can very easily see two sets of nerves. One is really long, going towards the incisors, and that's going to be our greater palatine nerve. One is going to be smaller, and it's going to be going back your throat or to the back of your throat, and this is the lesser palatine nerve. In order for me to ask you this question from the anatomized table, this is kind of the position I have to put the cadaver in, okay? And this is what it likely will look like. And so you've got to be able to visualize it from there. Again, I don't typically color anything on test day though, so it'll be the neutral colors that you see the cadaver in.